everyone, and welcome to Lipstick and Lipo, your unfiltered guide to plastic surgery by two board-certified plastic surgeons. My name is Dr. Ashley Amalfi, and I'm a board-certified plastic surgeon in Rochester, New York, and I am here with my dear friend and co-host, Dr. Smita Ramadhanam, who is down in New Jersey. Hi, Smita.
Hello, Ash. How are you?
I'm so great.
Excited.
Yeah,
I'm so excited about our topic.
Yeah,
I just can't wait.
Yes, and you are so we've been talking about top 3 things you need to know, and today we are talking about skincare. And you are like the skincare guru. Like, I'm a plastic surgeon, I know a ton about skincare, but I know that it is like your passion. So this is like it's a pretty exciting topic for us. Everyone loves beauty, right? Like
Everyone does. And I think that's the beautiful thing about skincare is it really, I mean, everybody should be on some sort of skincare.
Yes.
You know, our skin is the largest organ in our body. It plays a very important functional role, but, you know, it also ages us, you know. It either ages us prematurely, or if you take care of it, you can age gracefully. So, I mean, I think it's pretty special. And as surgeons, especially when we're operating on the face, we want our skin to be healthy so that you get the best results and you heal well. So today, our topic, top 3 things you need to know about skincare.
Exciting.
Exciting. Right. So, should we just dive in?
Yeah. Oh, yeah. I mean, I'll start it. So, the first thing you need to know is that everyone's skin is completely unique. So your skincare should never be the exact same as one of your friends or even someone in your family. Everyone's skin is completely unique and has unique needs, and that's going to dictate the products and the procedures that we do, right? I mean, even between you and I, you know, there's so many differences.
Yeah, I mean, I think that's important to know because, you know, we all have concerns with our skin, right? Whether it's just you want to have a glowing, dewy skin, or you want to address, you know, fine lines, or you're focused more on anti-aging, or you have pigment concerns or acne concerns. We all have different concerns when it comes to our skin. And furthermore, our skin is just different, right? Our genetics are different. The way we react to certain ingredients, different. So it's so important. This is really where your consultation comes into play, you know, because we can give you a very targeted regimen based on what your goals are and what your concerns are. So not one skincare regimen looks the same, you know.
Right. Yeah, it's not about following a TikTok trend that you see or that your friend is raving about something. Like, that might work really great for him or her, but it may or may not be really appropriate for your skin type. And that's why you want to see a professional to really have this sort of consultation and a skin analysis so that we can really look at what your concerns are and target a treatment and products, but something that's specific to you. Not everything is good for everyone. And just because it's the latest and greatest doesn't mean, you know, that something that's older and tried and true isn't a better option for you. So just be open-minded about it because your needs are unique, just like you.
Right. And I think, you know, you, again, brought up such a great point because I think skincare, more than really a lot of other things we do, it tends to be so trendy, right? It's almost like makeup, right? You can play around with makeup all you want. We don't care. It's fine. You know, have fun with it. But when it comes to your skincare, you really should use stuff that's effective, that's going to give you results, which I think brings us right to number 2.
Yes.
Which is medical grade skincare is not the same as any other skincare that you can buy at the drugstore, department store, Sephora. This is real stuff, right? It's real products with high concentrations of active ingredients. So it's almost like a prescription, right? Except you're getting it at your doctor's office, your plastic surgeon, your dermatologist office, facial plastics. But it's really what's going to give you results, right?
Yeah. You can't order
the price
this.
point.
Yeah. You can't. this is different stuff, you guys. This is not what you buy at the mall. This is what you buy through a medical provider, through a physician with a physician's license. And that there's a reason. It's just like a prescription drug. It's stronger. The active ingredients have higher concentrations. And that equals results. And but that, like you were saying, that comes with a price tag. But there's a reason, and it's because of its efficacy. And that's why not everyone can buy it, not everyone can sell it. It has to come through a physician's office, and that's the difference with medical grade skincare. I know that there's so many lines that you sell, and you have your own line, right, Smeta?
Yeah. Right. I do have my own line, and and I sell some other lines in the office that I like truly believe in. But you're right. I mean, I think it does. There's a couple of things. Like, I do think it comes at a higher price point, but then at the same time, you're not using a lot of product, right?
Tiny.
Because
tiny.
It's
lasts forever.
tiny about.
Yeah, this stuff lasts forever, you guys. We don't buy it like every month. We buy it like twice a year.
Twice a year, right? So, yes, it's a little bit more upfront, but at the end of the day, I mean, you go to a department store and you buy like a jar of La Mer.
Oh.
Like, you're paying probably more.
And there's nothing in it. There's like
no, your skin just feels really soft, but it's not healthier.
Lovely. Yeah. It's not it's not treatment. It's not treatment. It's just
it's not treatment.
It's just moisturizing. Right. But like medical grade is really going to treat those very specific concerns that you have that we talked about.
Right. And I think that's the important thing, right? Like, you want to treat our skin from within. A lot of these things, so it's funny. A lot of my patients come in and they're coming in for like skincare consultations, and, I'm talking to them and they're like, oh, I'm already on a retinol. Oh, I've been using vitamin C for X number of years, but, I'm still having problems with my skin. Well, then you start diving into like, okay, what lines do you use? What products do you use? And it's all these, like trendy department stores, Sephora lines, which are good, right? But they aren't going to give you the real results. So if you're doing everything that you should be doing, you're washing your face, you're using skincare, but you're not seeing results, it's because you're not on the right products, right?
Yeah.
So you're not on the right regimen. You need to be on the medical grade stuff, because yes, you can have 2 retinols, but they're not the same. Anything you buy over the counter is going to have less concentration, which is why anybody can buy it and use it without any issues. Whereas with us, you really want the supervision of one of us, board certified plastic surgeon or medical provider, to really make sure that you're getting the right treatment and not having any of the negative stuff associated with it. So it's worth the investment. I think if you're going to invest in anything, invest in good skincare.
Yes. Yeah. And young, you want to start that younger, before you have wrinkles, before you have too many concerns, because sometimes you get to a point where it's kind of too late, and there's so much damage that's already been done and so many things that are left untreated that, yes, it's still important to get on that line, but it's so much more effective to start this kind of stuff young. And, that kind of brings us to our third thing is, that there's, I call it like seasons of skincare. So there's like the seasons of the year where skincare might be a little different, but also like seasons in your life when you're younger, when you're in your childbearing years, when you're older. It's going to change over time. So you don't, buy 3 products and buy them for the rest of your life. It's constantly, it's fluid, it's changing, right? Just like we're aging, our bodies are changing. It's a fluid process, and your skincare should be seasonal as well.
Right. Yeah. I mean, I think that's so true, right? Our skin changes. We lose collagen, we lose elastin, which, when you're in college or high school, when you're young, use Dove soap. Like, nobody cares, you can do anything to your skin and it's going to look great because you just have a lot of collagen, you're producing natural oils, nothing's going to happen. But once you're sort of in your late 20s, early 30s, that's really when your skin starts changing in its quality. And then it continues to change as you get older, and with hormonal changes. And so you really want to sort of change your regimen based on those changes, so you're really getting the most effective treatment. And then, seasons, just like, summer, winter, fall, your skincare should be changing, whether it's adding moisturizers, taking away moisturizers, targeting pigment with retinols and things like that, lasers. I mean, there's so many changes, which is why, when you're sort of connected with one of us, we can sort of talk you through all of those changes so you're getting the best out of your regimen.
Yeah, you want to see a professional, you want to have, access to the best stuff and also, the best advice. And so that's why,
Right.
your plastic surgeons, your dermatologists, your facial plastic surgeons are really your experts in the skin and helping you take care of your skin. And that's what we're here for. So we hope you guys liked this, your top 3 things to know. I think this is all really, really good information. So share it with a friend, tell them what you've learned. And then tune in for more because we have a lot more coming your way with this top 3 series on lipstick and lipo. So make sure you subscribe on YouTube, listen on Spotify on your commute. And I will see you later, girl. We'll see you for the next one.
See you later, Ash. See you guys next week.
Bye, guys.